On April 1st, 2015, at approximately 0630 hours, I reported for surgery. Surgery started approximately 0830 hours to last 4 hours. It did not. I came out at 1430 hours, which is 2:30 p.m. Dr. Graves didn't even face my wife to tell her surgery not go as hoped. Pit scan not needed. He phoned instead. Was he there at all? I had to wait to be released approximately 2100 hours, 9 p.m. A resident doctor came to release me instead of Dr. Graves. I did not know who this person was, and I still don't today. He discharged me without discharge instructions. Improper practice. When asked about some kind of antibiotics, he stated it's not their procedure or practice to do so. I have hardening on my arm. It's like tight and swelling at this point. I did not sign any authorization permitting a resident to do anything to me. Another improper practice. The VA don't do that. April 2nd. So we got sent home. I had a poison drainage hemp vac removed that night. It comes out of the side of my arm into a tube for poison and draining, and I had that in a little cylinder. I'll get to later. April 2nd, 2015, the next day. Called back to orthopedics comp rehab, informed of the no discharge instructions on how to care for my shoulder. Told by Pam Rumley, the chief nurse of Dr. Graves, to no matter what, do you not take the bandage off for 2 weeks until 4/15/2015 was the post-op surgery to remove the staples. That's another improper practice. Within 5 to 7 days, a doctor or surgeon should see you to check up on the condition of your wound and make a determination at that point. Ever since that surgery, April 1st, my right shoulder bandage area kept a hardening area resembling the steel implants and anchors that they put in me. It was just hard. I don't know the difference. It's just hard. I just had a surgery. It's not my way of knowing no difference. I maintain a slight fever of 99.5 or less than 101 degrees. They told me if it gets to 101 degrees or higher, contact them. My post-op follow-up was April 15th, 2 weeks later. The day the staples come out, on my way to recovery, right? Wrong. Pam Rumley, Dr. Graves' chief nurse, took my wife and I to a pediatric room where my staples were to come out. Keep in mind, about every 3 days it was getting heavier, wet, irritating, big old bandage, bloody, pus, gauze, smelly. This heavy sore bandage equal to about 3 dirty baby diapers I carried on my shoulder until the day to get this staples removed, which was approximately 10 to 12 days. Pulling out bloody pus, gauze, and retaping the bandage constantly. At this time, Pam Rumley, Dr. Graves' chief nurse, removes the soaked wet bandage to reveal a very rotten smell, accompanied with a 1-inch bright green and 1-inch bright yellow, and then brown looking pus on the staples all along the incision. All along here was infected. It was green, yellow, and then brown and blood. And the bandage, it was all in the bandage. Big old bandage. The staples all on the incision. Still haven't seen Dr. Graves yet. It's been 14 days. He told my wife and I that he would check up on us in 2 days, which would be April 3rd. It is April 15th. Haven't seen nor heard anything from him except to believe that he's intentionally not to see us for some reason. What happened April 1st, which you'll see and understand that later as well. It's shocking to you as this is getting ready to be right now. Pam takes the bandage and just threw it in the regular trash can for Kleenex or paper. That wasn't a hazmat can. Not that infection poison. She seen all this and said, that's just normal after surgery. Did not notify anybody. My wife and I were looking at this infection, and Pam went to a cabinet to retrieve a box, a white box, about the size of a cigar box, and pulled out a silver metal staple removal tool, and proceeded to remove the staples without wiping off the pus on my incisions. She put the tool right through the pus, removed each staple, even through the light yellow and fluorescent green looking pus. She then put the tool back into the box and placed it directly back into the cabinet without wiping it off even. My wife and I looked at each other shocked of what we just witnessed, and immediately after this, she's looking for culture, saying they don't ever put these back where they're supposed to be. She finds them though, and takes a swab of each, the green and yellow pus, nothing else. Then she applied steri strips over all the pus. Still didn't wipe anything. The pus is coming in between the steri strips. Says she's going to get PA Sapp, who was someone I was supposed to see post-op. Dr. Graves never showed up. Never seen him at all. He's one that should have been notified immediately so he could have come and took a look at this, and it wouldn't have got where I'm getting ready to take you, where they took us to hell and back. Excuse me. Dr. P.A. Sapp, whom can only tell me about 2 exercises, table slides and small rotations to prevent stiffness. Although complicated, I could not do that. Dr. Graves never showed up, but lied on the record, stating he was present and supervised everything. Nevertheless, upon retrieving my records, the cultures never made it to the lab. What did she do with my cultures? I asked Dr. Graves. I had to see him at a later appointment on June 19, 2015. Dr. Graves was told at a later appointment maybe he was told Pam what not to do. Just could shrug his shoulders and lower his head. Sad. Just sad, ain't it? Just sad for any surgeon, and that's a teaching hospital we're talking about. After this 4/15/2015 post-op appointment, my shoulder is tight, hard to this touch still, swollen. I'm not now believing it's the steel implants alone, but I don't know nothing more. I'm believing in the lab results. Maybe they'll see what's up, and I reckon like normal doctors do, and get infection swabs to the labs and go from there when the lab results come back. Not me. Those infection swabs never make the lab. I was running and keeping slight fevers and chills, but not over 101 degrees. They didn't ask, after several calls, they didn't ask or want to see me unless otherwise, if it was 101 degrees or more. Improper practice, another one. 15 days now has passed, and not knowing my life is in jeopardy. Dr. Graves is intentionally avoiding me, and on per this intention, I'm dying. About 12:30 p.m. April 24th, 2015. This is the date of my first emergency surgery from all of this, April 1st and 15th. I woke up to a loss of about 2 cups of fluid was drained from a hole from the staples. I was told from a doctor that if it did not come out, it would have shut down my liver, kidneys, and then to my heart, causing my death. It drained all over my chest, my shirt, and onto the bed. I immediately phoned Dr. Graves again, in which you never get to talk to him. But one of his nurses calls me back to inform me of a doctor appointment at 3:15 that afternoon. A resident of Dr. Graves. So given my condition, I took the appointment and went. The nurse never advised me to go to the ER. From my point, the Davie Medical Center out past Tanglewood exit is a long way, especially with my wound constantly draining. His name was Dr. Shields. When we finally got to see him, he took one look at my wound while it was draining. I was trying to keep bandages on, it just kept draining. And said he'd be right back. Within 2 minutes, he came back with a camera. He took a couple pictures and 2 pictures and excused himself, and this time was gone out of the office for about 20 minutes. Where'd he go? He went to try to let Dr. Graves know what was going on. When he did come back, he said sorry to us about at least 4 times as he was helping me rebandage my wound, and told us that he was afraid that I had a terrible infection and would need to go to the emergency room at the big house, which is Wake Forest Hospital, emergency room. He said they most likely was going to have to admit me. So now we're going all the way to the hospital, now 5 o'clock on a Friday. Why couldn't I just come to the emergency room? What did Dr. Shields was going to do for me? That's a waste of my time, our time. Once at the ER, too many students around me and repetitively checking with me. Finally, the charge nurse told me that I will be admitted, but waiting within the hour for emergency surgery to reopen and try to clean and remove infection. During this procedure, a culture was taken. It had to grow the germ, in order to identify to try and kill it. That took 3 to 4 days. Within those 3 to 4 days, Dr. Graves came to my bedside one time at about 8 o'clock at night. I was watching Monsters Inside Me. I couldn't watch it no more, so I turned the channel. I told him about it. He said, well, you do have monsters inside you. He said, we have to do another, kill this, find out what this germ is and kill it and see what happens then about another surgery. During this time, they put an IV in my left hand and distributed antibiotics, salines, fluids, which was causing my hand to hurt, redness, swelling, and balling up on my vein. Every time they would use it, I told them that something wasn't right and it hurt like heck. All they could tell me that it was normal, and sometimes it just feels that way. There was no IV team to check on me, so I denied any more using my left hand and made them put an IV in my right hand until I was discharged by May 1st, 2015. Because my extremities were used up with the IV on my left, the IV was in my right forearm, my right shoulder wound. Left elbow was a PICC line, which was installed 4/28/15, the day before my 3rd surgery. It got infected, hurting bad, red, and swollen, and all the nurses kept telling me that it was normal for this area's tendon. That PICC line was infected already. My blood pressure had erroneous readings. I asked if day I put them on the burn unit floor. Had a manual hand blow cuff with using a stethoscope. They did not. I said, this is a teaching hospital. Why don't you have a stethoscope and a hand blow in case power or something happened? You don't need one. They did not. They had to go find one before they could do me again. No more machines, blood pressures anymore. 4/29/15. This is my 3rd surgery in the month of April. My tendons and everything cutting back into it and then stitching it and cut back into it. It is it's excruciating and hell and back. It's hell and back. On 4/29, the third surgery, Dr. Graves wanted to reopen my wound, flush it, close it, and send me home. And if any other further complications like redness, swelling, or fever come back to the OR and another surgery to remove all the steel implants and the stitches. I seen him in a pre-op anesthesia holding room and demanded him to do it this time, which he agreed and removed them. At this time and present moment, I have nothing in my right shoulder. I have no steel implants. I have no, the sutures had to be cut to get those removed, and they just sewed me back up. From 4/29/15 or early, I was put on an antibiotic called ciprofloxacin, Cipro for anthrax, and vancomycin, which is also an antibiotic to take home and intravenously use into my infected PICC line they just released me of, which was in my left elbow. I was discharged with an infected PICC line. At this home visit on the discharge of May 1st, supposed to be discharged April 30th, but since no discharge plan in effect, I was discharged May 1st, 2015, on a Friday, to meet an in-home nurse from a company at 3:00 p.m. Here again, discharge with no instructions, information, care of wound, or hemp bag still in my arm. Dr. Graves wouldn't and couldn't even tell me of a hot or cold compress to help my shoulder. Up until on May 1st, when we got home and met this in-home nurse, we had the in-home nurse house meeting. We were shown how to administer these medications, Cipro and vancomycin, per Dr. Graves, an infectious disease doctor. They had a plan to put me on this for 4 to 6 weeks, without checking for CK levels or creatine levels. I'm as good as gone. Dr. Graves, an infectious disease doctor of the hospital, did not check my CK levels nor creatine levels not one time when I was in that hospital from 4/28 to May 1st, where they were giving me vancomycin and Cipro. It was killing me. I had MRSA. It was resistant to at least those two antibiotics. I wasn't being checked at all. I was dying. Up until May 6th, 5 days, my wife was giving me those intravenous injections every 3 times a day, every 8 hours, on that infected PICC line, making sure that the bubbles come out and do it right, that it's a pure flow, so I don't get an air bubble going to my heart or in my veins. She never went to school day one for a medical assistant of any kind to be giving me anything, or a certificate of any health care of any kind to be giving me that, whereas in Dr. Graves and them sending me home with this for her to do this was sending her home to kill me in my bed. Up until 5/6/2015, still chills and night sweats, slight fevers. Both the nurse and myself was really worried about my PICC line. She measured it, the lower, middle, and the top of the PICC line of my arm, and was planning to remeasure it on Friday, 5/8. Instead, on 5/6, I notified Dr. Graves' nurse, informed her of my conditions of the PICC line and slight fever and everything, which was approximately 12 p.m. noon on that day. And I will be coming, and told her I will be coming to the Wake Forest hospital's emergency room about 3:00 when I would be able to go. She warned me at that time that if I couldn't get a ride immediately, to call for an ambulance, and that I wouldn't be able to wait until 3:00 p.m. So my wife and I drove to Cone Health ER on Highway 68. Once at the ER at Highway 68 Cornell, I was placed into a room, and from this point on, questions were asked. Expressions sympathized, pity on me for what I was going through. They kept me at peace the best they could until the ambulance from Wake Forest arrived about 4 o'clock p.m. I then was given a pain medication for that bumpy ride per my situation. Upon arrival to the Wake Forest Hospital ER, many residents, approximately 8 personnel, were experiencing a one-of-a-kind encounter of me and asking me the same questions. 3 to 4 stethoscopes on my chest and in my back, trying to monitor my breathing. This I did not like at all. About 4:55 p.m., right before this nurse's time to get off shift, the charge nurse or doctor of the emergency room at Wake Forest that day asked her to do an ultrasound on my PICC line on my left elbow area. We were in the room alone, and she was looking around my PICC line and said, "Oh my." Did I know what sepsis meant? I said no, and she told me that my infection was on the verge of sepsis, poison and getting into the blood, going to my heart, killing me. It gets in my bloodstream and reaches my heart. Furthermore, she said I also was threatened with DVT, deep vein thrombosis. She showed me everything as she took the pictures. I have everything I need, evidence. Also, there were many sticks with the needle, unexplained. You can't see with the naked eye. That astonished her. She offered her deepest condolences and printed them off. About 7 p.m., I was taken to a room for readmittance, third time now, or second time. I got off a gurney, and I noticed that the room was 1/3 smaller than the room I previously had, and would definitely have a high risk of me falling again. So I told the nurse I would not take this room. She said she would get the charge nurse. She came to see what was the matter. I told her that they gave me a hemoglobin in my left hand vein, infected PICC line in my elbow, and caused me close to septic and DVT, along with a concocted MRSA from this hospital in my shoulder, and I deserved to at least have a clean room. She asked me what did I mean, and I swiped my finger along a louver of the inset wall lighting and had literally a 1/4 inch of lint dust fall off my finger. She looked at that and said, "Hold on, really?" She seen it and said she would make a couple phone calls and be right back. I looked over towards my wife, and we made the decision that from all we had been through with this hospital and staff, we were leaving. So we left and walked out while a charge nurse was trying to thwart our departure. A person with improper practice. A person with or without an infection should have a clean room. Now I wonder about the operating rooms, B rating, and anything else. So we were leaving, and we then proceeded to High Point Regional Hospital's emergency room. From triage, check-in, to doctors, nurses, they were flabbergasted at things such as asking, like, what is that in your arm? Talking about the hip back. How long has it been there? That PICC line is infected and is going to have to come out. Cultures were taken, but later came back negative. The check of my liver and kidneys, per that medicine, vancomycin and Cipro that the hospital had put me on, they had never checked it. Well, the emergency room doctor did have it checked, and it was 2.2 my creatine level, and about to shut down my liver and my kidneys. Eventually, they discontinued those medications from Wake Forest Hospital and administered me different ones and saved my kidneys and saved my life. I was given vancomycin and Cipro for anthrax patients at Wake Forest Hospital. And at High Point Regional, they discontinued this and put me on daptomycin and Invance. Wake Forest Dr. Graves, ID doctor, had never checked my creatine for CK levels. He didn't know what they were. He was asking me on that later appointment on June 19th. So I told him so that he could help other patients like myself because for any reason that if they did not know, now they know. And I didn't mind that. God forbid. Due to my limitations on my body at High Point Regional, I had to have another PICC line put in me to start fusion for 30 days straight. They said that the only thing that they could do, or I was going to have to do, was I had to go through another surgery. And they was going to have to put a PICC line, tunnel it through my jugular vein and down to my heart. I had to go through this too, also. And I got released on May 12th. I started my fusion and went through my fusion through June 6th. I had to see Dr. Graves again. While I was there, before I was discharged, 4 doctors, nurses told me that unlikely no orthopedic doctor would see me, and I'd have to go back to the one that Frankenstein me. After several attempts, they were right. This camaraderie of doctors not seeing other doctors as patients has got to also change in my proposals. On June 19th, I asked Dr. Graves, why did I get the infection? Was it from the staple, what Pam didn't do? He said, oh, no. You got those staples from a superbug that was used by a knife. He told my wife and I that a superbug was definitely on the scalpel or tool used, or the implants, or the anchors, because it went and grew down to the bone. I was literally bad to the bone. Dr. Graves said when he opened me up on the 24th of April, he had never seen any kind of infection to look like that. I imagine it was bright green and yellow, as y'all were probably saying. And the 28th, when those pieces got taken out, and I'm left with the way I'm left, I have a dislocated shoulder per those surgeries. And on June 19th, he wouldn't give me an MRI or X-ray or order one because I want to know how I look today. And I still don't have MRI at this moment on how I'm left with today. But the shoulder is definitely dislocated. Every little move, every little bump in the car, I keep myself as best as I can to keep from being disgruntled. And I know this is God's will. This is bigger than me and what I have to do. I need all kind of help that I can get. Social media, I hope that you're the answer. Today, America, together, we the people can change tomorrow and our children's future. I urge you to share, view, spread the word. Another change is coming. Never a reaction without an action. For actions is stronger than words. Papa Bet will be back with you more soon. Most likely about something else, if not more of this. May God bless each and every one. May God bless this mess. And may God bless the United States of America. My hashtag, when everything matters, survive this. Thank you.